Allergen awarded 4 Emerging Clinician-Scientist Fellowship Award since 2011. I believe that this fellowship is the highest annual research award of all fellowship in Canada. And I feel very fortunate to be the 3rd recipient of this prestigious award. So as an emerging clinician scientist, I'm studying a molecule called interleukin-21. It's a protein that plays a key role to stimulate the immune system and the antibody production. So through my research, I'm looking at a group of patients that suffer a disease that's called common variable immunodeficiency, or CVID. And these patients, they have a problem with their immune system. They have recurrent infection like sinusitis, pneumonia, but they also have feature of dysregulated immunity, such as autoimmune diseases, and they even have more risk of cancer. And in the laboratory, we discover that the immune cells of these patients were not maturing normally following this stimulation. And the absence of these more mature immune cells, or cells that regulate inflammatory reaction in the body, was really related to their clinical symptoms and health problems. So in the laboratory, we developed a method where we use a different molecule in combination with the IL-21, and in order to be able to test if these different combinations were in fact able to mature further their immune cells. And we discover that for a group of CVID patients, the combination of IL-21 and IL-4 was successful at triggering the maturation of the defective immune cells. And this is interesting because it could have some potential therapeutic down the road for these patients. I certainly believe that my research will benefit patients with CVID, but I also hope that it will be useful to patients with other antibody-related disorders or even patients with immune dysregulation. The fellowship really helped me to establish the basis or the foundation of my research by the enrollment of the CVID cohort. It also helped me to acquire advanced skills in high technologies and laboratory techniques to be able to study the patient immune system. It was also an essential requirement for my recruitment as a pediatric allergist immunologist at the Montreal Children's Hospital. And I think it helps me to be a better physician.